Hello everyone, I'm Dr. Abirami, your physiology faculty. We are here to discuss physiology recall questions from INICET May 2025. Overall, there were around 10 to 12 questions in physiology, and half of them were on basic concepts and remaining half with a clinical touch. Let's start off with the first question. The first question was on location of tight junction in a cell. So we get confused with two options here, apical and apicolateral. Let's clarify that and then we'll come back to this. So this is the structure of the cell junctions. In the structure of cell junction, we have to understand that there are two sides for any cell. So this is called the apical side and this is the basolateral membrane. The cell junction, which is very close to the apical membrane, not on the apical membrane, very close to the apical membrane, and it is very tight. It means it is not allowing most of the substances to pass through. So how do you name this as? Absolutely, tight junction. This becomes the tight junction. Tight junction is made up of occludins and claudins. That is why it is otherwise called as zona occludin. Since it is very tight, this will help in formation of blood-brain barriers, blood-aqueous barriers and tight water seals like intestines and nephron, wherever you want to prevent leak of water. So this is the structure of the tight junction, and as you can see in the image, it is not on the apical side but on the apicolateral membrane. On this wall, it is on the apicolateral membrane. So the right answer would be apicolateral membrane. The other question, IGF-1 and IGF-2 are structurally similar to which structure? Insulin-like growth factor 1, insulin-like growth factor 2. They are both insulin-like. So their structure is very much similar to that of insulin. If you see the amino acid sequence, the tertiary structure, the alpha and beta chains, all this is almost similar to that of insulin. So we'll go with insulin here. The next question, which of the following is involved in explicit memory? What is this explicit memory? There are two types of memory, explicit or declarative memory, implicit or non-declarative memory. Explicit or declarative memory is again of two types. If you are able to remember facts, your subjects are all facts, it is called semantic memory. And the areas of the brain responsible for this are lateral and anterior temporal cortex and prefrontal cortex. Episodic memory. Episodic means events. If you are able to remember date, place, time, all this, it is called episodic memory. The areas of the brain responsible for this, hippocampus, medial temporal lobe and neocortex. That was also the question. Explicit memory, you had the option of hippocampus there. So hippocampus would be the right answer. What is the other type of memory? Implicit or non-declarative memory. This is again of four types: procedural memory, priming, associative learning and non-associative learning. Procedural memory, it's a procedure. So you need cerebellum, motor cortex. Procedure means it's a movement. So you need your striatum. Striatum is basal ganglia, cerebellum and motor cortex. Priming is by neocortex. Associative learning, amygdala and cerebellum, because you have conditioning responses there. Pavlov's experiments. Non-associative learning, which are by reflex pathways. So hippocampus would be the best answer for explicit memory. Calculate the tetanizing frequency in a single muscle if the muscle contraction period is 40 milliseconds. Tetanizing frequency, the formula is 1 by contraction period. How much is the contraction period? 1 by 40 milliseconds. Let's just convert millisecond into second. 1 by 0.04 second. And this would be 25. So the tetanizing frequency, which is 1 by contraction period, when we solve this, we get the answer of 25. So we'll go with 25. At high altitude, which of the following response will be seen? So this is about respiratory and metabolic acidosis and alkalosis. At high altitude, what happens? As you climb a mountain, as you go higher and higher, there is hypoxia which you face there. So at high altitudes, the partial pressure of gases is less. So there is hypoxia at high altitude. You climb Kodaikanal or you climb Ooty Hill, there is hypoxia on top of the mountain there. In response to hypoxia, this would stimulate your peripheral chemoreceptors and therefore you start breathing faster. When you start breathing faster, you send out more carbon dioxide. So this carbon dioxide wash out. When you send out more carbon dioxide, CO2 goes out of the body. CO2 wash out. There is a CO2 washout. When you send more CO2 out of the body, CO2 is an acid. It's a volatile acid. When acid goes out, body goes for alkalosis. And CO2 is related to your lung. So it is respiratory alkalosis. So the best answer would be respiratory alkalosis. The next question on surface tension in the alveoli. Surface tension increased during inspiration. Let's say this is an alveoli. During inspiration, this becomes like this. So when you take in air, when there is inspiration, the alveoli becomes like this because the radius volume increases. So if these are all the surfactant molecules, they are all the surfactant molecules. During inspiration, because of the increase in radius, what happens? The surfactant molecules are all distributed like this. So relatively, if you see, there is a dilution of the surfactant molecules. The same surfactant molecule, when the alveoli expands like this, the relative concentration of the surfactant decreases. When the relative concentration of the surfactant decreases, what is the role of surfactant? Surfactant helps to reduce the surface tension. But here during inspiration, when the relative concentration of the surfactant decreases, surface tension would increase. Surfactant will decrease surface tension, but when there is a reduced concentration of surfactant, surface tension would increase. So we go with surface tension is increased during inspiration. The next question. A patient is asked to close his eyes and then reopen them. Which of the following EEG waves would show a decrease upon eye opening? When you go to bed and you start to sleep, initially you just lie down there with you lie on the bed with your eyes open. When your eyes are open, your brain will record beta waves. Then you close your eyes are closed and you relax. When you relax, your brain will record alpha waves. After that, you enter into the stages of sleep. Now what happens? When your eyes are closed and you are relaxed, you're recording alpha waves. But just think, if you remember of your exam dates, your results or something which is giving you more of stress, immediately this alpha will go into beta. Again you come back to beta. That's why you're not able to sleep. This is what happens during your exam time also. You want to sleep, but your exam results come to your mind. The day before your exam, just think, you will not be able to sleep because every time you go to alpha, you think about your exam or your results, it will take you back to beta. This we call it as alpha block or desynchronization So the patient is asked to close his eyes and then reopen. So you would go from alpha to beta. So you will see a decrease in the response of which wave? Alpha waves would decrease because it is turning up into beta. So the answer would be alpha waves. The next question on Frank-Starling's law. Which of the following pulse is based on Frank-Starling's law? What is Frank-Starling's law? Preload. What is preload? Before the heart is getting loaded, what is filling the heart? Preload. Who's filling the heart? Your veins. So what is preload? Veins or the venous return. When your veins are returning blood into the heart will go into its end diastolic volume. It is getting filled up. So this will go into end diastolic volume. So what is preload? Preload means venous return or end diastolic volume. And this would be directly proportional to the stroke volume. Yes, more you fill the heart, more will be the stroke volume. And this is called as Frank-Starling's law of the heart. Preload venous return or end diastolic volume is directly proportional to the stroke volume. That is Frank-Starling's law. What happens in pulses alterans? There's an alternate pulse, a weaker pulse and a stronger pulse. So once you have the weaker pulse, this usually is seen in left ventricular failure. In left ventricular failure, it means left ventricle is failing to contract. So when there is left ventricular failure, automatically less blood only goes out of the heart. So the end diastolic volume keeps on increasing. Therefore, there is an increase in end diastolic volume. More the end diastolic volume, directly proportional to stroke volume. So stroke volume also increases. So this relation is seen in pulses alterans. The relation between end diastolic volume and stroke volume. The next question, components of basal-gyrich reflex. What is basal-gyrich reflex? Whenever there is any irritant chemical substance in the heart like serotonin, that would stimulate vagus nerve. And vagus causes decrease in heart rate. Vagus is parasympathetic. So this would cause decrease in heart rate, decrease in blood pressure and also apnea. Bradycardia, hypotension, apnea. This is basal-gyrich reflex. So bradycardia, hypotension is seen. Definitely tachycardia, hypertension is not seen. The center which causes fever during infection is fever response, a rise in the body temperature response is because of posterior hypothalamus. Because the function of posterior hypothalamus is shivering. What happens when you shiver? All muscles in the body are contracting. When muscles contract, more heat is produced. So that is the mechanism of this rise in body temperature. So this is actually an attempt to raise the temperature and to kill the infectious organism. So this is done by posterior hypothalamus. With that, we complete our discussion on Physiology INICET May 2025 recall questions. Yes, remember, life is 10% only what happens to you and 90% how you react to it. Thank you so much for joining with me in this session. Thank you.